HIV and AIDS both are not same. HIV is a virus that transmits from one person to another person. And AIDS is a situation arise due to the HIV infections, and that situation is a stage 3. In these situations, we can define AIDS by 3 criteria. I am Dr. Ketan Ranparia, HIV AIDS specialist. Our today's topic is what you must know about HIV and AIDS. Take an example. Someone just diagnosed HIV positive today. So I will explain all the things that is required by any HIV positive person. First, which way HIV can transmit? There is only 4 ways. First, infected blood transfusion. Second, especially those are indulged in injectable drug users, infected needle and syringes. Third, HIV positive pregnant lady not on ART medicines, then risk of getting transmission of HIV from mother to child. In 3 stages, it can be either during pregnancy, second, during delivery, and third, during breastfeeding. And the 4th reason is unprotected sexual intercourse. It can be in between the 2 men or in between 1 man and female. All 3 kinds of the sexual activity can transmit HIV: anal sex, vaginal sex, and oral sex. But highest risk is associated with anal sex, and lowest or negligible or almost nil risk is associated with oral sex. So these are the main 4 reasons by way HIV can transmit. Simultaneously, it is also very important to know which other way HIV cannot transmit. Mainly our social contact, like sharing one common toilet, bathroom, soap, furnitures, cooking by HIV positive person, washing a cloth of HIV positive person, and not even by the utensils, like eating in the common plate or drinking from a same glass. This way, HIV cannot transmit. Next question. How HIV virus damage our body? Take an example. India is a country, and approximately 10 lakh soldiers are there to protect our nations. But if somehow number of soldiers in our country reduced to 5 lakhs, then there is risk of attack from our outside the country, our neighbor, or terrorist. The same way, our human body also come in contact with many microorganisms, bacteria, virus, by inhaling the air, drinking liquid, eating food, or in skin contact. But normally, we are not getting infections or disease on daily basis, because in our own body there is a soldiers that known as a immunity systems or rog pratikarak shakti. So this immunity power protect us from all these microorganisms. But When someone got HIV infections, HIV virus enter into our body. At that same time, HIV virus attack on our soldiers, that's known as a CD4 count. Normal range of the CD4 count is 400 to 1500 in any healthy living person. But once the HIV virus enter into our body, this HIV virus enter into the body of our soldiers, that means CD4 count, multiply inside CD4 count and destroy our CD4 count, CD4 cells. So over a period of times, number of HIV virus will increase day by day. And one day, our CD4 count will go below our lower range, that means 400. Approximately 7 to 8 years need the CD4 counts go below 400, below lower range. After that, person can get a symptoms. Initially, this 7 to 8 years, in person body, HIV virus is there, but HIV symptoms are not there, because our body can try to maintain our CD4 count in the normal range for almost 7 to 8 years. After that, system exhausts and CD4 counts goes below 400, like 300, 200, and so on. Even then, if person not got HIV diagnosed or patient got diagnosed but not taking ART medicines, that means allopathy ART medicines, or taking non-effective other alternative medications like herbal, homeopathic, or Ayurvedic. In that case, CD4 count will go below that, 300, 200. If the CD4 count reach below 200, then it is a very serious condition. Immunity system is almost finished out, and at that time, very big chance that person will get a very serious disease or infections. It can be like tuberculosis, PCP pneumonia, cancer, or like any other disease. And that situation is known as AIDS. First, person must be HIV positive. Second, CD4 must be less than 200. And third, some serious infections or disease like tuberculosis, PCP, that is a pneumocystic kidney pneumonia, cancer, or any such serious infections. This condition is known as AIDS. If person still don't start ART allopathic medicines, then there is very extremely high chance that person will die in next 1 to 3 years. So, to live a healthy life and full life, it is a most important thing. Person should put himself or herself on allopathy ART medicines, that also known as antiretroviral therapy. So, what is the solution of this problem? We learn till now that if you don't take a treatment, virus will go up and up, and if you don't take a treatment, CD4 count, that means our soldiers, will go down and down, and less soldiers, more chance of other infection attack. So, is there any cure for HIV till date? Answer is no. HIV cannot cure at present by any means. That means not by allopathy, not by ART, not by Ayurvedic, not by homeopathy, not by herbal, or not by any other rituals therapy. So this is the fundamental things every HIV positive person should understand and choose the wise treatment options accordingly. Best treatment that can control the HIV infections almost completely and can give a healthy, normal life, and that is a allopathy medicines. That is a ART medicines. That is a antiretroviral therapy. Person has to take only one pill a day, and most of time that one pill contains three type of medicines. This medicine or pill cannot kill the HIV virus, but this medicine can control the growth of HIV virus, and virus cannot able to grow himself. So natural lifespan of HIV virus in our body with or without medicine is only 1 to 2 days. And with help of these medicines, HIV virus will die after 1 or 2 days, but without producing their children's or sub virus. So slowly, number of virus in our body that is known as viral load, and viral load means number of HIV virus in 1 ml of our blood will decrease, and within the 3 to 6 months viral load can come down to the level of not detected. That means number of virus will be so much less that even the laboratory machine cannot detect that virus in that our blood samples. Once the viral load become less than 1000, that means the infection is under control. If viral load is less than 200, in that case HIV virus cannot transmit from the infected person to the non-infected persons even without condom sex. That will be useful for those couples, those want to the child. And if viral load is less than 50, in that case, with other fulfill conditions, we can reduce the dose of medicines. And once the viral load less than 20 in most of the laboratories machines, that will denote it is a not detected. That does not mean HIV cure, but that means the virus is such a low that HIV virus is number of HIV virus in blood is such a low that laboratory machine cannot detect. Our goal should be non-detectable viral load. And once the viral load is non-detectable level, the same process, the CD4 count slowly will go up. This process can take few weeks to few months. This cannot happen in 1 or 2 days or few days. So every patient should be patient for enough time to recheck or retest the blood for CD4 count and viral load. There is no use of retesting the CD4 count and viral load every monthly or every weekly. You have to wait for every 3 months or 6 months time at least. When 90% patients will regain the CD4 count normal, that means the in between 400 to 1500. So once the patients got a non-detectable viral load and the CD4 count more than 400, in that case, patient is as good as other HIV non-infected persons, as healthy as other non-HIV infected persons. And that persons can live their full, normal, healthy life. Some other most commonly asked questions: is there any vaccines for HIV positive people? So today there is no vaccines, but clinical trials and the research is going on for two kind of the vaccines. One for the HIV positive peoples that will known as a therapeutic vaccines that might be helpful to treat the patients in future. And the second is preventive vaccines that for the common men, those who are not infected with HIV virus, but might be these vaccines will helpful to prevent the HIV infections into their persons. But both kind of vaccines not available till date. It's under research. Other crucial social life issue is marriage. Can HIV positive person got married? Yes. Another question leading to that answer. HIV positive person can only marry with HIV positive or HIV negative also. The answer is that person can marry both HIV positive or negative. But condition is that before you indulge in any kind of the relationship, it is a social, sexual, or marriage life, you have to disclose your HIV status and your treatment status to opponent person. If you got married without informing or consent with proper consent, then you will be in the trouble. So never try to hide these crucial informations for any kind of the long-term relationship. Another frequent questions, can HIV positive person go abroad? Will get visa for that? Answer is yes and no both. In today's world, most of developed countries like America, Australia, Canada, Europe, they give the visa also to HIV positive persons. No problem. You have to disclose your HIV status and treatment and basic reports, and you will get a visa. Your visa will not deny on base of your HIV status. But some few countries are there, they don't allow HIV positive persons for long-term stay. That stay can either for residentials or the work related. So you have to check the one website is there if you want to go into details. travelhiv.org or hivtravel.org. In details, you will get all the details about it. But another things, can I stop the medicines after I recover? No, you can't. You can't stop medicines. Does this ART medicine have a side effect? Each and every tablet on this earth has a side effect. But benefit of treated by this medicine is thousands times more than the risk of getting any side effect or any big issue. So you don't have to worry about a side effect because the effect is the 1,000 times better than the side effects. And unfortunately, if someone gets some problem with medicines, there are way you can solve that problems. You can change the medicines. You can change the timing of the medicines. So doctor will be there to help you out. I hope for any HIV positive persons, all the basic questions are answered in this series. And if you have any more questions, we will cover in our upcoming video. Thank you.